I am delighted again to welcome you into HealthWise, the TV show. I'm your host, Ralph Hipp. My guest today is Dr. Alan Helmbold, and he's alongside me this morning. He is a cardiac electrophysiologist. How about that, with the Cotton O'Neill Heart Center. He joined the practice just last month. Glad to have him here in Topeka. And Alan specializes in heart rhythms. Our topic today is AFib, atrial fibrillation. Dr. Helmbold, it's a delight to have you here in Topeka.
Thank you very much,
Ralph. Cotton
Thanks
O'Neill,
for having
and
me.
on our show, HealthWise.
Thank you very much.
Well, we know, I think a lot of us do know the term atrial fibrillation, AFib. It's one of the most common heart irregularities we have. And describe for me, when we are in atrial fibrillation, what's happening with our hearts?
Well, Ralph, you're absolutely right. AFib is the most common arrhythmia that we see in the heart. Approximately 2% of patients under the age of 65 have AFib. Approximately 9% of patients over 65. About 5 million people in America, expected to grow to approximately 15 million by the year 2030.
It'll triple by that time?
Yes, sir. That's what we're expecting as the population is aging and living longer with the medical problems that we develop as we go older. We are expecting to see more of it as time goes by. So I think we have a diagram available
we do
of
have
the heart.
a heart picture we'd love to show you at home, and tell
up.
us what do you want to describe about this, Dr. Helmbold?
Yes, sir. So if you initially ignore the white stars in the top of the heart there, the top two chambers, and look in the top left of the picture, the sinus node is where the electrical signal from the heart normally originates. And then it spreads through all of the muscle cells, and then the electricity is what causes the muscle cells to contract. And then the signal goes down to the bottom of the heart through the AV node, which you can see there kind of towards the middle of the picture, middle top of the heart. If you were a person standing on the edge of a pond, dropping a rock into that pond, the same rock over and over again every second, when the rock hits the water and the wave spreads across it in a uniform controlled way, that would be more like a sinus rhythm. Well, atrial fibrillation, now when we look at those white stars, atrial fibrillation is more like you're taking hundreds and hundreds of rocks of various sizes and shapes and dropping them all over the pond at different times. So it creates an electrical chaos. And because there's no electrical coordination to the heart, there is no muscular coordination of the muscle fibers in the top of the heart. So that's essentially what's going on in atrial fibrillation.
When we have AFib, Alan, what does it feel like inside our chest?
Yeah, so atrial fibrillation sometimes, which is very scary, can be asymptomatic. So that's one thing that we have to worry about. But the people who have the symptoms in atrial fibrillation, it can cause their heart to race. They can feel their heart skipping, running fast. They may feel tired. They may feel fatigued. They may get lightheaded, shortness of breath, and things such as that. Sometimes they get a lightheaded when they stand up.
That would be a definite symptom.
Yes.
If you get suddenly lightheaded. Would that be a symptom of anything else, or that's a definite no, you have atrial fibrillation?
Oh, no, sir. That could be multiple things.
Several things.
Yes, sir.
Right.
Yes, sir.
So when they come to see you, what sort of diagnostic exam do you do to determine that it is AFib?
Yes, sir. Excellent question. So we use electrocardiograms, looking at the electrical activity of the heart to diagnose atrial fibrillation.
We have our patches on our chest.
Yes,
and
sir.
You have the wiring and check that out.
That's right. Typically 12 if you're in the clinic or in the emergency room. If you're having symptoms such as this that are coming and going but not present when you're being evaluated by your medical team, then we can connect you to a monitor that you can wear for several days, looking to screen for it and hopefully pick it up that way.
Right. Dr. Helmbold, with 5 million going to 15 million by the year 2023, so many more people will have this. Is this really anything to worry about?
Oh, absolutely it is. The two main things you worry about with atrial fibrillation are the risk of stroke. Since the top of the heart is not mechanically contracting like it's supposed to, then blood can form and pool and develop clots potentially, and then those clots can go off and cause problems, either a stroke to the brain, which in atrial fibrillation it's a very unfortunate scenario because those strokes tend to be very large and debilitating. Also, something could go off to somewhere else in your body and cause an embolic event that way, but not to the brain, though uncommon. Additionally, because the top of the heart is electrically firing, many hundreds of times, even over 500 times a minute, just electrically, those signals can go to the bottom of the heart and cause the bottom of the heart to run fast. And just like any other muscle, if the heart's overworked for too long, it can begin to fail and become weak. We call that a non-ischemic cardiomyopathy.
My goodness. Well, we have a couple of minutes. We've learned so much about atrial fibrillation from Dr. Alan Helmbold today. And how do you manage it when they come to see you? What are the treatments, Alan?
Oh, yes, sir. So depending on your symptoms, it can determine whether or not we try to control the rhythm and keep you in a normal sinus rhythm,
right.
or if you're not that symptomatic from it, sometimes we can allow you to be in AFib, assuming your heart rate doesn't go too fast. And then we also have to address your risk of stroke. When you look at certain other medical conditions such as congestive heart failure, high blood pressure, age of 65 or older, diabetes, if you've had a stroke before, if you have other vascular diseases like peripheral vascular disease or coronary artery disease, or if you are a female, those things can increase your risk of stroke, and depending on how many of those have, that may warrant the need for a blood thinner, a true blood thinner, an oral anticoagulant to reduce that risk of stroke.
Like a Coumadin?
Yes, Coumadin is the old tried and true.
Yeah.
There are newer agents as well, not that Coumadin is not bad, there are newer agents as well, such as Xarelto, apixaban, and including Pradaxa, that don't require as much monitoring and don't have as many drug-drug side effects. Unfortunately, some of those drugs are a little bit more expensive for our patients, so obviously sometimes we have to determine what's best and what they can take.
We always say exercise is the great medication. What are some of the things we can do to prevent going into an AFib situation?
Well, exercise is true, that is a great thing, but too much of a good thing can be bad for you. Some of our elite athletes and marathon runners can actually be more prone to have AFib.
I see.
Sometimes there are other triggers, alcohol, heavy consumptions of alcohol, sometimes over-caffeination, energy drinks, things like that. Additionally, sometimes obstructive sleep apnea, getting treated for CPAP, or even stress sometimes can lead to this. But it's prevention, management of high blood pressure, which is the most common risk factor, not smoking, diet and exercise are all good things to help reduce your risk of atrial fibrillation.
Some very smart things and great advice. Atrial fibrillation, our topic today. We have learned quite a bit about it.
Yes, sir.
Dr. Helmbold, thank you so much for coming to see us on HealthWise.
Yes, sir.
And put those words of wisdom into use, folks. We're going to help you do that in just a moment here. I do want to remind you, though, HealthWise hosts those monthly senior suppers at Stormont Vail. They're on the second Monday of every month, all the way through November, and you're invited. It's 5:15 p.m. for just $5. Then hear a speaker, maybe like Alan, on a very interesting health or wellness topic. Call the Health Connections number at 354-5225 to make your reservation. We'll see you there. Well, next up, let's get some exercise, and not too much of a good thing, though. Our HealthWise TV exercise segment, some fun, invigorating, low-impact exercises right now.